Hello, Nakasero community. It's yet another World Sickle Cell Day, and most or a few questions still linger and go unanswered. Today, we are here to experience or explain more about sickle cell, and together with the Ministry of Health, understand the initiatives of this Sickle Cell Day and the goals that we uptake to help combat the disease. So what is sickle cell? Sickle cell disease is genetic inherited disorder. Let's say a blood disorder, which you get from your parents. And it has to be two parents. Contrary on what the community believes, you need two parents with the sickle cell trait to pass on this gene to their children. We need to understand that screening of both parents helps us to understand and know who is at risk to carry this genetic material or to pass it on to their children. How do you know that your child has sickle cell disease? Sometimes, depending on the severity of the genetics or what you've inherited, symptoms can range from a few months after birth to as old as older. So we don't have a timeline to be able to tell who will present when and how. But a few of the symptoms that we know that we look at include yellow eyes, low blood, but this together with family history can point us to a direction that this is sickle cell disease. With sickle cell, we have multiple complications and crises that these children go through that not only impact us, the healthcare team, but also the parents at home, socially, economically, and financially. So this is the reason we are here to remind you again on what a struggle it is and what we need to do together as a community to reduce the consequences that sickle cell has impacted on our community. Together with the Ministry of Health, we've come up with a few strategies that we know can help combat disease and reduce the risks of inheritance. And the very most important ones have been to educate the spouses and the couples on what transmission is, who can get it, and how can we get it so that we reduce the risks of inheritance. So, as a community, we urge you to be able to check premarital counseling and have this test done as partners so that you know if both you and your partner carry the AS gene. If you and your partner carry the AS gene, you understand that the risk of transmission to a child is higher than if you do not carry the gene. And this would help you to make decisions earlier about conception and the modes of conception, or if you still want to go ahead with this relationship. Once the child is born, we look into options like early newborn screening, which is our latest new strategy to help understand disease early. I know most of my parents have asked me, so what does the newborn screening help? Can you cure the disease? Of course, I cannot cure the disease. But once I know that your child has sickle cell early, I know that we are able to start treatment early, follow up early, and even plan curative methods early if at all you're capable financially of doing the curative methods. The goal of screening and the role of screening early is to help these infants have better disease, modify morbidity and mortality so that we have less consequences of the disease. Here at Nakasero Hospital, we are here to help you provide these services. We don't only provide the newborn screening tools or the method, but we follow you up as a couple. We work with you on this journey and provide you the best care you need. Thank you.